So much for coming to this activism update. My name is Heidi Schoonmaker. I'm the chair of the Environmental Health Action Committee at AMSA. And at AMSA, we see opportunities to reshape medicine as future physicians, and environmental health is really one such area in which there are so many opportunities for change. So AMSA's Environmental Health Action Committee really sees our mission as twofold. Firstly, to educate our future physicians on exactly what the connection is between the environment and our health and how our environment shapes our health. And then secondly, to inspire folks to act in ways to support the health and well-being of all of us and our future. So we're really grateful today to talk on both the education and advocacy side of things for environmental health. And we're so grateful today to have our two panelists, Dr. Patz and Dr. McClure, and I'm going to bear with me while I share my screen. Thank you guys for joining. Can you all see the presentation? Nods?
Yes.
Okay, great. Thank you so much. I appreciate it. So these are our wonderful panelists, Dr. Patz and Dr. McClure. Dr. McClure is a Seattle native who went to medical school at Oregon Health and Science University in Portland and trained in internal medicine at the University of Washington. She works in primary care in Salud and Espanol in Oakland. Since her climate awakening, she's been organizing within her own medical group and beyond as both a CMA delegate and AMA alternative delegate, as well as starting a nonprofit called Climate Health Now to activate colleagues to use their uniquely trusted voices to advocate for policy-level climate solutions in order to protect health. She welcomes you and reaching out to her. If you're inspired to link arms in advocacy, you can see these, you see on your screen, you can contact her through that email address or on her Twitter. She just started the Climate Health Now, is currently championing the Insure Our Future Health Insurer campaign. And so far, 60 health and environmental groups have joined together to call on health insurers to divest billions from the fossil fuel industry. We've got information that I'm going to share with you guys right as soon as I'm done speaking on that campaign and the press release for that campaign as well. Dr. Patz is the who was newly inducted this weekend into the National Academy of Medicine. Congratulations, Dr. Patz. He's the director of the Global Health Institute at the University of Wisconsin-Madison. He's a professor and the John P. Holton Chair of Health and the Environment with appointees in the Nelson Institute for Environmental Studies in the Department of Population Health Sciences. For 15 years, he's served as the lead author for the United Nations Intergovernmental Panel on Climate Change, the organization that shared the 2007 Nobel Peace Prize with Al Gore. He also co-chaired the Health Expert Panel of the U.S. National Assessment on Climate Change, a report mandated by the U.S. Congress. He is committed to connecting colleagues from across campus and communities around the world to improve health for all, and is continually striving to integrate his research into teaching for students and communication to policymakers and the general public. Dr. Patz has written over 90 peer-reviewed scientific papers, a textbook addressing the health effects of global climate change, and co-edited the 5-volume Encyclopedia of Environmental Health. He most recently co-edited Climate Change and Public Health and is leading a massive open online course titled Climate Change, Policy, and Public Health. He's been invited to brief both houses of Congress. He's served on several scientific committees for the National Academy of Sciences, and he's served as founding president of the International Association for Ecology and Health. In addition to directing the university-wide Global Health Institute, Dr. Patz has faculty appointments in the Nelson Institute, the Center for Sustainable and Global Environment, and the Department of Population Health Sciences. He also directs the NSF-sponsored Certificate on Humans and the Global Environment. He's double board certified, earning medical boards in both occupational and environmental medicine and family medicine, and he received his medical degree from Case Western Reserve in 1987 and his MPH from Hopkins in 1992. So thank you so much to both of our panelists for being here today. I'm going to kick it off quickly to Dr. Patz first. I want to ask you, Dr. Patz, you have spent your entire career learning about and educating others on the link between the environment and our health. Can you share a little bit with us about what you've learned?
Sure. Why don't you unshare your screen and then we can see other people. So of that long, wonderful introduction. It was too long, but thank you. The most important piece of it is when I was at Case Western Reserve in medical school, I headed up our environment section of AMSA. So it all started with AMSA. But I've always been interested in the upstream determinants of health, prioritizing prevention, and promoting health through reducing exposures to risk factors. So I have always been interested in eliminating or reducing environmental risk factors. So I had that orientation all along. I think I just had an appreciation for nature. Maybe that was part of it. And in medical school, with my involvement in AMSA, and then through my residency, my first residency in family medicine, I looked at farmer work exposures and always was looking upstream. And that orientation landed me into pursuing a master's of public health at Hopkins, and then a second residency in occupational environmental medicine. And from there I got, during my MPH at Hopkins, I saw a paper on climate change. This is 1991. And I thought, there are not many papers on this, and this is a big deal. This is air pollution, it's population policy, it's in all sorts of economic and social determinants wrapped up into one issue. And I thought, I think this is a big deal, and I just pursued it. So as during my master's of public health, pursuing this issue that just was not well documented. And one last thing I'll just say, my occupational medicine residency had electives in it. And for the electives, I chose something at the World Health Organization and then at EPA. During my MPH, I dove into climate change and I wrote this big paper on it. And when I was at the World Health Organization, the Intergovernmental Panel on Climate Change, the IPCC, approached WHO and said, we didn't have a health chapter in our first report, we need one. And WHO folks said, what the heck are you talking about? What's climate change? So I overheard this conversation and I laid my manuscript down in front of the director, who grabbed me by the scruff of the neck and threw me into this UN meeting and said, go represent us. And then I organized an author team for the first chapter that went into the IPCC. So that was in 1995. And then the rest, I'll stop there and then, we can go to other questions.
I could sit here and listen to you tell us all this kind of stuff all day. It's encouraging to hear that it's electives and kind of just a thought of, hey, I don't know a lot about this and this hasn't been written yet. So maybe I should start thinking about these things. I love that curiosity and appreciate that perspective. I really want to ask you about how medical schools and what's the medical education, the curriculum around environmental health. Are medical schools educating their students in climate change and climate solutions?
So when I went to medical school 80 to 100 years ago, we were barely getting enough in occupational history, and very little. There's so much crowding of the medical school curriculum. So we were always fighting to get more on environmental and occupational medicine into this. Right now, with climate change it's no longer a debate scientifically; it's only a political debate. And climate change, it's happening, it's here, it's now. The science shows it's about human activity, pollution mostly, burning fossil fuels. So it's about us causing it. And there is scientific consensus on that. The harms are tremendous and dangerous, so it's really bad news. But there's hope because of the solutions. We don't have to wait for them. The price of renewable energy has dropped through the floor. We know how to solve the problem. It's only now a matter of political will. So I think that the awareness is up. The youth movement has been very important as far as pushing hard. And medical students are extremely tuned into this and demanding more courses. I teach an online 2-credit course, Climate Change and Medicine. It's now in the required curriculum at University of Wisconsin in Madison, where 100% increase in required lectures in climate change. But what does that mean? 100%. That means going from 0 to 1. So we have 1 hour required, but there is demand. So I think that, and there are other medical schools. There was a survey came out maybe 3 or 4 months ago that there are more and more medical schools that are bringing this into the curriculum. It's not enough, but it's happening.
Which is encouraging, I guess, encouraging to hear. And I appreciate your teaching students at University of Wisconsin-Madison. I have a question for you about if you wanted every medical student to know something about how the environment affects our health, what would you want them to know in 7 minutes or less?
No, that's 2 minutes or less. That'd be way too long of an answer to any question. It's a simple thing. You can't have a healthy population on a sick planet. And our health absolutely depends on environmental conditions, on the health of functioning ecosystems that are providing food and fresh water, wetlands, filter water. Stable climate is important for all sorts of reasons, as far as agriculture, as far as disease dynamics, and one reason why tropical diseases are tropical is because they require the tropical climate. So our health, we would be absolutely fooling ourselves if we think that our health is dependent on the healthcare system. The healthcare system is important, but if you don't look at, clean air, clean water, safe routes to schools, cities built for promoting physical activity, green space for mental health, and functioning ecosystems to avoid spillover events, which is the root cause of our COVID-19 pandemic right now. That's conservation. That's forest conservation, ecosystem conservation. So to not think that, environment is absolutely, our health depends on it in so many ways. And COVID-19 is such a wake-up call for the world. The idea that if you mess with Mother Nature, you're going to have a deadly pathogen in your living room. So, and COVID, I can bookend COVID with environmental factors. On the front end is disruption of ecosystems and spillover from one species to another, and then throw in a little bit of the wet markets and international travel. But the root cause is ecosystem disturbance. That's front end. And then the back end, you saw probably the study from Harvard that that air pollution, a tiny bit of air pollution, like I think it's for every 1 microgram of fine particles, PM 2.5, 1 microgram per cubic meter, leads to an 8% risk of dying from COVID after controlling for all the confounding factors. That's impressive and scary. And then the other I won't say there's any good news about COVID, but it is certainly a bit of a silver lining. These pictures of New Delhi, India, before the pandemic and after, and you see this unbelievable difference in air quality, the brown soup on one side and then the clear skies when the fossil fuel global economy has been shuttered. 7 million people die prematurely every year from air pollution. So I hope that, when people say, let's get back to normal, it's like, no. We need to leap forward. Everyone's talking about build back better. We need to get We don't want to, you know, uncork the conventional fossil fuel economy when we realize how many people air pollution kills every year. So this is a golden opportunity to not go back to normal, but to go forward to a low carbon economy.
Couldn't agree more. This question is for both of you. I'm wondering if you guys can speak to the role of medical students and physicians in advocating for health. What do you think that role is?
I'll let Ashley go first.
Sure. Yeah, I will go back actually to, and if it's possible to share, Heidi, maybe
Yes.
it's slide number 11. So I don't know if anybody else has come across this before, but the AMA kind of about 20 years ago actually re-articulated sort of an updated Hippocratic Oath called the Declaration of Professional Responsibility. And this subtitle is Medicine's Social Contract with Humanity. And in terms of why there's a role for physicians and our healthcare team really to engage in advocacy for the upstream social determinants of health, I think is really grounded here. And sometimes it's helpful to have those, you know, the texts to look back to when there's some skepticism. So I subtracted out, you know, what wasn't really relevant for today, but the second of our contract with humanity is that we refrain from supporting or committing crimes against humanity, which I would submit to the audience, the friendly audience, is that climate inaction is a crime against humanity. So that's one of the reasons why we have a role in advocacy for climate solutions. The seventh one they listed is educating the public and polity about present and future threats to the health of humanity. Check. And then number 8, which I think really gets at the intersectional elements of the climate crisis, which is also, you know, a social justice issue, is that we promise, and part of our professional responsibility is advocating for social, economic, educational, and political changes that ameliorate suffering and contribute to human well-being. So, you know, that couldn't line up more clearly with kind of the need for urgent climate policies and action. So, and then the other piece is that this would be kind of fun. If anybody wants to write in on the chat, who do you think, if you poll Americans generally, what profession do you think is the most trusted on average? Dr. Pats, you can't answer this. We have any brave first somebody who wants to chat in?
I think the consensus is nurses.
It is, you're totally right, yes. And then doctors are a close second, you know, and then pharmacists are a third. So the medical community, the downstream healthcare community, has the market on social trust, which is so valuable right now because of, you know, fake news and gaslighting and how divergent reality has become. But we have this, and I really say it and I mean it, that nurses and physicians have a climate superpower, which is trust, and no other professions can bring that trust to the discussion about climate change than we can. And so because we have to do this urgently, we have to build social will urgently, we need to leverage that trust to the greater good, which obviously climate solutions will do. But we're up against the Koch brothers, you know, and Exxon, and they're very well funded, and their media strategists are much better than anybody, you know, worried about things other than profit. So what we have in the face of that is trust. So that's what I would say to our why we have a role in advocacy for climate and kind of all the environmental intersectional, you know, changes that we need.
Yeah, that's very well said, Ashley. And I'll just add a little to that. Yes, and we have the trust. And dovetailing what you said about, would we really want to be supporting things that make us unhealthy? You know, that's crazy. So the fact that we have fossil fuel subsidies you know, doctors and nurses should stand up and say, this is like subsidizing tobacco. This is subsidized, this is unhealthy. And I know that there are medical schools and hospitals that are divesting, just like universities are, divesting from fossil fuels. So that's part of the responsibility. There is, I think I mentioned the Medical Society Consortium on Climate Change, which is a collection of many medical societies on board with this. And there are chapters of this group. This is, you know, doctors and nurses and other health professionals using their trusted voices to get out there and say, this is a health emergency. Climate change is health, and we need to act. So that's really important to carry that message. And Heidi, maybe you can share the link to the report that we just released from a consortium of groups, the university here, plus the Wisconsin Health Professionals for Climate Action, very concerned group. So there's a lot that doctors and nurses can do, and because of the, as Ashley mentioned, you know, we, I mean, I am one too, but I'm not practicing. You know, we are the spokespeople. We are the trusted messengers to get out the message. And I'll just say that, I'll repeat, but more succinctly, the 10 words from Ed Maybach, who's from the Center for Climate Change Communication at George Mason University. You know, they're 10 words. It's real. It's us. You know, we're causing it. So there's scientific consensus. It's bad, so bad threats. And there's hope. You know, 10 words that distill it into that. And then the hope part, I think we'll get into a little bit later, Heidi, when we talk about why this is a golden opportunity. So I'll stop there.
Thank you both. Dr. McClure, this question is for you. So why have you become an advocate for climate solutions as a physician?
Mm-hmm. I'm going to share my slides for fun, if possible. Maybe, could you help me? Oh, you could do it. If you could go to slide 7. So I had a baby a couple years ago, and this is the one. When I was at home on maternity leave with her 2 years ago, I realized I could watch documentaries, and this was the first time I'd had a break in training for a long time. And she was napping, and I realized I could watch movies on Amazon Prime on my phone, which I did while she was napping. And I watched the Inconvenient Truth sequel, which I didn't know, Jonathan, that you'd shared that history with Al Gore on receiving the Nobel Prize. Is that right?
Well, I was one of the lead authors for the IPCC. So the IPCC shared the Nobel Prize. So being a lead author, I got a plaque and everything, and you know, I'm part of the team. So I don't, not like Watson and Crick, but you know, I was on the IPCC.
But it's really poetic that this movie really woke me up, you know, from my small world, my training, my, you know, personal life. So I watched that, and then if you could push forward, Heidi, on the slides. So I had this new baby, 5 months old, and you know, if anybody's, you know, loves kids, becoming a mom, I would say broke me open to the vulnerability of humanity, and having the concern for her future, for all children's future, and seeing that we're on this glide path for complete instability and struggle, like Lord of the Flies is kind of what I think of if we don't change things. So then the next slide. So I watched this movie, you know, have this new baby who makes the future more important than ever understood before to me personally. And then we had the infamous Paradise Fires here in California. And I know Sarah Shearer, who's on the call here in the Bay Area, it was, you know, unhealthy air for a couple of weeks 2 years ago. And I had this complete vision of like, this is where we're bringing our children, is unhealthy air to breathe. You know, the kind of the unnatural disasters, we're headed towards this. And I think being Americans, being relatively wealthy, all of us, we're educated, healthy. We have I feel such a sense of responsibility for how challenging our unstable climate is going to be. I just felt like I got to channel this, eco grief into action. And so shortly, I guess it was the next fall, kind of culminated at the youth climate strike here in the Bay Area, where I met Sarah Shear, who's on the call, and we, like 30 doctors and med students, we went to the offices of elected officials in the Bay Area and said, climate change is a health emergency, like use this framing. Health framing helps people to support the climate action that we need. And it's really been I now call myself a new title, which is a medical community climate organizer, which I would encourage all of you to use and be with, Dr. Pats, who's kind of led this decades ahead of me and us, and to really engage, because we take oaths to protect humanity. And I think in today's age, this is really the most important use of our medical expertise. So I'll leave it at that for that question.
I love that.
I'm wondering while Heidi, while the slides are up, I have a follow-up. If you could go to slide 3, you said why did we get into this area? And so this is one slide. When you look at the risks of climate change, in the green box, look at all those different pathways through which climate affects our health. And on the right side, you can see various climate-sensitive diseases. So in the first hand, this is why I got into it. I said to myself, this is big, this is a huge challenge. And so that's the reason. But then now, go to the next slide. I am really, instead of the risk, I have my entire research team, we are looking at the opportunities by solving the problem. So I feel like so many sectors are at risk from climate change that to continue to do the risk assessment, I don't think that's going to help with the moving policy. In fact, I remember someone asking me, say, if you tell me you predict that 1 million more people will die from X, well, climate change cuts across every sector. It affects everything. So the more, the stuff you're going to tell me about more risk could be in the noise. So we're focusing on the opportunities that looking especially across these 3 sectors, the energy sector, the food sector, and the transportation sector. I mean, look at the millions of people that die prematurely from each of these sectors. The first one is obvious with air pollution. The food sector, this is from this new Lancet Commission report that came out last year. They talk about can't remember the name of the diet. It's a recommended universal diet. That's pretty much what you all know, which is, no or little red meat or dairy, mostly plant-based, nuts, and all the things that you would think about Mediterranean diet. But we are so overshooting that in the types of energy-intensive foods, especially red meat and dairy, and processed meats and starchy foods, that if you got to this universal, mostly plant-based diet, but not entirely, that would save 11 million people every year. And the physical inactivity, the automobile-dependent society we're in, the World Health Organization estimates there's a real cost now to sedentary lifestyle, millions of people. If you do one last slide, Heidi, next one. We did an analysis in Wisconsin, and if you look on the right in the map of our state, if we were to get to a clean energy, rely on clean energy done in state, which is mostly wind, solar, 4% nuclear, we don't go up or down on nuclear, a bunch of other things, and conservation, you can get a fully green energy base in Wisconsin. And in so doing, you'd save almost 2,000 lives and all this list of health outcomes. What does that mean economically? You look on the left, from the reduction in fine particle pollution, PM 2.5, which is 18 billion, and a little bit extra for ozone, you would save $21 billion every year in our single state of Wisconsin from avoided mortality and health damages. And because we know that jobs and health they come together, you would net 162,000 new jobs in renewable energy. So these are really important messages, I think, to tell people, and that yes, it's a climate emergency, it's a health issue, it's not just the environment, it's about our health. But to solve the problem, in the panel last night where we had doctors and nurses talking about this report we released, somebody had a great metaphor. They said, climate action is not like taking medicine. It's like taking a tasty, chewable multivitamin. I love that metaphor. So it's a golden opportunity. I think we need to be pushing this very positive message that climate action is enormous for health benefits and health promotion.
It's true. And I feel like at a time where it's ripe with opportunity for improving so many people's lives, simple policy solutions can do so much to improve everyone's health and well-being in all of these ways that you've laid out in just Wisconsin alone. I feel like at this time when we're all a little bit, well, maybe I'll speak for myself. I'm a little up to my ears with policy stuff and generally the politics. There are opportunities for us as clinicians to get involved, not only in educating our policymakers, but also in campaigns such as the one that Dr. McClure just started. These are things that we can do today and don't necessarily rely on other people to get things done, if that makes any sense. So that segue, Dr. McClure, do you mind talking a little bit about the campaign that you just launched calling for health insurers to divest from the fossil fuel industry? Can you share?
I would like to talk about nothing more. But I just want to say, Dr. Pan, I'm so grateful for your work, and I wish every state had this, because I think you're so right on that, the comparative costs, just people don't get it. Even like really smart people don't get it. And I think when you say this is the benefit, it's just that reframing of the benefit in like such a visible, simple way is absolutely what we need in every single state and for the whole country, really. So thank you. So Heidi, yeah, that's it. So I want to also acknowledge, the racial justice aspects of climate advocacy, and it really is captured, this new term to me at least, intersectional environmentalism, I think is captured with this from he's the director of strategic operations from Sierra Club. His name's Hop Hopkins. He says you can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people, and you can't have disposable people without racism. And if you push forward on the slide, so this is an example of a sacrifice zone, right? So this behind is Southern California. This is a place where they're fracking, and then this is a playground, which you can guarantee without seeing any kids there, there's not wealthy, white, privileged kids who play on this playground, which I think is an illustration of a sacrifice zone, and why climate advocacy activism is about social and racial justice as well as climate justice. To the next slide. So realizing that money is a big motivator. I have some amazing partners that I'm working with who they've been working on divestment campaigns, really focusing public attention in coalitions on the investments of insurers. And they've so far done it for property property insurance. So trying to kind of prevent the Keystone pipeline, for instance, from being insurable. And then also all of the premiums that people put into insurance companies, trying to demand that those premiums are not invested in climate chaos through Exxon and coal and things like that. So the new thing that we literally launched last week in a coalition that's led by health groups, medical groups and health groups, but other kind of environmental advocates also, is we're calling on health insurers, the top 10 kind of largest by market share health insurers in the US. We're asking them to divest their investments from fossil fuels because they are, there's a major conflict of interest. So if you go to the next slide, it shows the top 10 US so in total, these top 10 insurers have $24 billion fueling climate change and making our communities sick in a way that worsens health disparities because of those sacrifice zones also. So the next slide shows, so Metropolitan Insurance has $18 billion. This is from 2017 in fossil fuels, followed by Cigna, which with 2.2 billion, and then Aetna at 1.4 billion. So we just this week sent a letter to the chief investment officers, co-signed by over 60 organizations, saying we are calling on you to divest because of the health implications of your investment choices. And this is what we're really going to be focusing on. So if you go to the next slide, we're just starting this divestment campaign. Next slide. And it's just going to be about focusing attention and really shaming them / inspiring them to make changes in order to stabilize the climate. And we're in good company. So the BMJ early this year, just pre-COVID, launched something called the Investing in Humanity divestment campaign, calling for individuals and also healthcare institutions to divest their money. The AMA 2 years ago had passed a divestment resolution. So now it's policy. They haven't made much progress yet, but it's policy to stand on. And then more recently, the UC system just divested its fossil fuel investments, and they really centralized that it was all about the returns, which in most venues, you know, that's kind of what moves people. So we're in good company. And then the next slide. So if this is something that you want to kind of join in on, we need help kind of getting the word out and social media messaging, writing letters to the editor. There'll be a lot of opportunities to engage if you're interested. And I think, let's see, if you go forward one more, you know, I'll put something, so we're just calling on them to divest their money from what's making our community sick. So we can stop on the slides. And then I'll put a link in the chat if anybody's inspired and wants to kind of get involved with social media messaging and kind of promoting this campaign along the way, because we're going to need lots of help. It's all about coalition action. So that's my answer.
I love that. I so appreciate it. And thank you for that. I want to, I'm going to quickly share also a toolkit, the Dear Patients Toolkit. If you guys are in getting involved, I think I shared it. And then in the interest of time, I wanted to get to a few audience questions, including Brianna's. I might be sending the same thing over and over again, but I'll make sure while we do audience questions that I'm sending the right stuff. But Brianna had a question earlier. What are ways to integrate climate action into direct patient care? This is for both panelists.
Do you want to go first, Jonathan?
Well, I will have a short answer because I am not doing much. Well, I'm not doing any patient care. But I do think, I think we just need, number one, to talk about it. I don't know if you want to show that one slide of my TEDx, which is to just spread the word. So number one, talk about it and have people recognize that, you know, if you could just Google my name in TEDx, it's a 19-minute version of why climate change is a health issue and why solving the problem is a great opportunity for health. So to talk about it with patients, and then to, you know, you could, you know, think about how they get around. Do they, you know, as far as travel and things like that. But I think that it's more, so not to be afraid to talk about it and to think about conservation, but it's more than just taking the composting out and things like that. It's real a matter of engagement. I think where it's more important is for physicians to be active with other sectors, other leaders, urban planners, local leaders, and I will say at every level, including demanding for the end of fossil fuel subsidies at the national level. So I think it's more a matter of engagement. I'll leave it to you, Ashley, to say, you know, what do you do in the, you know, patient-doctor relationship?
And I think it's similar to like, what should I do in my personal life to lighten my personal carbon footprint? And I think the greatest yield of our powerful voice is not in direct patient care counseling about climate change. I think it's the wrong space because the patient can't do anything about it. I mean, it's like talking to your patient, like saying, you know, you live in a food desert. You should really move so that you're not. Like,
Yeah.
it's not the right venue. The right venue is doctors organizing and talking to policy makers. And the right venue is leveraging the you know, lobbyists of our medical institutions and saying, we prioritize policies, because this is policies, right? It's not individual solutions that we need. And inside the exam room, that's just the individual, you know. And I think really the place, we all have finite energy, unfortunately. The place to focus is in collective policy solutions. And I think organized medicine, AMSA, obviously is a powerful voice, and kind of, you know, making it policymakers on Capitol Hill say that the medical community won't shut up. We have to do something on climate. That's what we need to do, much more than individual counseling, is my humble opinion.
Right, and I see a comment in the chat about the last IPCC report, the 1.5 degrees centigrade report, which happened after the 2015 Paris Agreement, where the world leaders asked the Intergovernmental Panel on Climate Change to do a scientific assessment to say, well, how do we stabilize at 1.5 degrees? Because above 2 degrees centigrade, everything falls apart. And so that's sort of the impact scientists are saying, please don't go above 2 degrees. Ideally, don't go above 1.5. And so this is what has activated the world and the youth movement, that we have to cut emissions 45% by the year 2030. So in 10 years, we have to nearly cut emissions in half and be carbon neutral by 2050. So that is the urgency and how fast this has to happen.
Yeah. I will say one other thing in terms of Sarah's question in the chat of, you know, what can we do with how busy residency and medical school is? I think it's all about teams, right? It's joining a team, whether it's AMSA or Medical Students for a Sustainable Future or AMA or CM, you know, whatever your organization, it's joining it and doing, channeling your energy to create climate leadership across all medical organizations. That's the way that I see, because the medical, so the, you know, Dr. Berwick talks about this, that the healthcare constitutes 17% of the US GDP. So we are a hugely powerful sector, And our sector's mission is protecting health. So, you know, with this existential threat, with this incredible economic potential impact for good, if we decided to prioritize lobbying and advocating for climate solutions, I think it's all about joining a group and you know, making climate the priority of all of those groups.
You're
And
here.
can I say one thing? So people are voting, right? The most important election is in 12 days, I believe, and is happening as people are voting from home, thank God. So a coalition of medical and health organizations has come together around a letter, an open letter to America's patients.
So Heidi, that's the last slide, by the way, slide 30, if you want to put that up.
Thank you. So this letter is written by, or signed by over 4,300 nurses, physicians, medical students, nursing students, and what it's articulating some of the health harms of climate change, and then it's asking our collective patients / America's voters to help us protect them and their health and their family's health by voting for climate leaders right now. So we just sent out the press release today. And so I put this last link that I just put in the chat is a social media amplification toolkit. So if you are inspired and you want to open that up and, you know, post on Twitter or Facebook or email your medical class, that'd be great. To really get the visibility around this letter so that as people are voting, they're like, huh, all these doctors are worried about climate change. Maybe I should vote for somebody who's going to do something about it. That'd be really helpful.
I have one quick question that might not be that quick. But we've kind of touched on a few different potential barriers, not only personal barriers in terms of timing, but also just generally. I'm wondering, what do you both see as barriers for getting policies such as the Green New Deal or also like equally progressive policies pushed forward or programs being enacted? Do you guys see any big barriers?
Koch brothers, Exxon, lobby money, fossil fuel that wants business as usual, that's killing us is what I would say. Just like big tobacco, you know, it's a profit motive that we have to stand up to.
Right. And again, to keep messaging that this is not a partisan issue.
Mm-hmm.
You know, we are doctors that care about protecting people, and we couldn't care less about some of the, you know, that we don't have a vested interest other than that we care about the population, our patients, and it's not a partisan issue. And so that's very important to communicate. It's important to communicate. It is a health issue as much as everyone on this call completely knows it's a health issue. I remember after I gave that TEDx talk, people came up to me and said, wow, I had never realized it was a health issue. And I'm thinking, aren't you reading my papers? Anyway, like, yeah, right. Sure, they're going to read my paper. But number one, climate change is not a tree hugger issue. It's not just polar bears. It's about health. So I think we have to make sure we communicate in that way. And that I'm sure you know, some of you know the climate scientist and evangelical Katharine Hayhoe. I love her line that someone asked her, you know, well, do you believe in climate change? And she says, absolutely not. I'm a scientist. It's not a belief. I know the facts, right? Mm-hmm. So I think communicating that there's not really scientific debate about it. It's not a partisan issue. You care about health and climate change is a health emergency. That's what I would be pushing for, recommendations for communication.
Mm-hmm. Yep.
Well,
I think the one other thing is the report that Dr. Pats just did that was in the chat somewhere up above, the medical alert, with Ed Maybach, who's a brilliant communications specialist, you could say, and he's done lots of studies that show when people are presented with climate change as an issue, the way that they are most likely to support climate policies and action is if climate change is presented through the health frame. So if you present it as an environmental frame, they're like, you know, not highly motivated. But if you present it as a asthma and your kid or heart attacks and your mom issue, that's what kind of builds that that support that we need. And so I think, you know, that's really why the health frame is so important to talk about climate through.
And also a caveat, and some of Ed's latest work is that use the health frame and also make sure you have positive messages, that it's real, it's serious, but there's hope. Otherwise, people will, they'll be they can't handle it. So really important to talk about the opportunities, and because they're big opportunities.
Yeah.
And for all those reasons, our voices are all the more powerful as future clinicians. I just wanted a moment to say we're coming up on the hour, and I just want to say thank you so much to our panelists, Dr. Patz, Dr. McClure, for your work and for sharing your insights with us here today. We're so grateful to you. Thank you. For anyone who's been inspired, we've shared lots of different opportunities in the chat box, but we've got them here as well. Everyone should be voting. Please vote first and foremost. You feel free to please sign this letter. You can scan the QR code right here with your phone camera, and it'll take you right to the letter that you can sign. There are several different links here, and they've been shared in the chat as well, to help spread awareness of Dr. McClure's divestment campaign. And if you'd like any more updates on the campaign, we'll link to the Google form. I'll link this right at the end. And then if any of you have been inspired to join our committee, please do so. You feel free to send me an email at chair.at.amsa.org or heidi.schoonmaker, whichever is easier for you to spell. And please consider tuning into our talk tomorrow from Dr. Don Berwick at 8 p.m. He's going to be talking about the moral determinants of health, and we're so grateful to him as well. So thank you so much, Dr. Patz and Dr. McClure. We're so grateful to you for your time and for your work. And yeah, thank you. Thank you so much. And
our pleasure. Yeah, thank you. And anybody, please do be in touch if you want to work together.
And Heidi, thanks for allowing me to loop back to AMSA, where that started my career path, the environment section of AMSA many years ago. So this was really fun for me.
I love that.